and welcome back to Sam Mingo's YouTube channel, the best place for all things money and medicine and entrepreneurship, but we'll get to that later. In today's video, we'll be answering a medicine question. Should I pursue a primary care job to solidify my medical foundation, or should I enter a specialty that I love? This is the most common dilemma among new grads. Here's the unpopular answer. It doesn't matter. I say choose your boss, not your job. Choose a job that is a good fit for you and choose a specialty you're passionate about. Don't overthink it past that. As a new grad, you're in the infancy stage of your career. It's like asking a 10-year-old kid, what do you want to be when you grow up? Most 10-year-olds will say maybe a police officer or a teacher or a marine biologist. But then as they get older, most of them don't want to be a police officer or a marine biologist. In fact, most people in this world, they're late boomers. They may not even find a specialty in love or even their purpose until much later on in life, and that is completely normal. The beauty of the PA profession is you have options. You can explore as many specialties as you like, and if you want to go and be an orthopod, by all means, orthopod away, but find a good orthopedic practice to work for. Here's a PA hack for you. Most of you will find that it is not so much about the actual specialty as it is about your actual employer. Your employer will make or break your job. Long hours and less than ideal pay may make you a little bit bitter about the work that you do, but generally speaking, the biggest impact on how you feel about your job is your boss. The person who you report to has an enormous influence on your success, your professional growth, and your happiness. So what constitutes a good boss? A good boss understands that you have a life outside of work and respects it. A good boss helps you find your purpose in that company. A good boss celebrates your small wins. A good boss invests in you, both professionally and personally. A good boss sets you up for success, and a good boss solves problems with you, not for you. Now, I'm going to ask you this question. Is that good boss always found in urgent care or primary care? No, the answer is no. A good boss can be found in any specialty. You can have an amazing boss who will train you extensively in neurology, and within a few years you can be a neurology expert, loving the field and all the science behind the brain and the spine. Or you can have a really crappy boss who throws you in the trenches and makes you see 30 patients a day without a lunch break. Do you think you will love neurology then? Probably not. Also, new grads, listen, don't be afraid to lose your medicine when you commit to a specialty. Yes, if you don't treat hypertension every day, you're probably not going to remember when to choose an ACE versus a calcium channel blocker. But can you relearn that information? Absolutely. There are so many resources available to you to learn all about hypertension. You have up-to-date, Hippocrates, CME conferences. You have books available to you, free online resources. You have your colleagues. You have your supervising physician. You have resources. All you have to do is relearn everything that you forgot. Trust me, it's just like riding a bike. Your real education starts when you graduate from school. You see, in PA school, you learn the basic fundamentals of medicine. But in clinical practice, you apply those skills to real life. And as a new graduate in a specialty or even in primary care, you still have to learn and read up about new diseases and best treatment practices. You always have to learn and relearn new things, whether it's a procedure you haven't done in years or a new drug that you've never heard of. In my first PA job, I worked in an outpatient internal medicine clinic in Connecticut. My supervising physician was the kind of supervising physician every new grad should have. He taught me everything from medicine to finance to work-life balance, everything. And after 2 years in internal medicine, I felt so comfortable and confident treating my own patients. So when I left the practice to go to San Francisco, I got a job in family medicine with a much younger population. So I had to relearn a bunch of medicine that I'd already forgotten. In that new practice in San Francisco, my patients were young, they were healthy, nobody had AFib or CHF, but everybody was on Adderall or antidepressant and they had a lot of STIs. So all these things that I wasn't treating in Connecticut. And also, when I transitioned from my primary care job in San Francisco to my urgent care in Las Vegas, there's also a huge learning curve. I haven't treated patients with blood pressure readings of 110 over 140 acutely. I haven't done procedures since 5 years ago in the clinical year. I had to relearn how to reduce a fracture, how to read x-rays, how to drain abscesses, and how to run codes. So it was a very tough few months just to relearn and adjust everything. But it was doable because I already had a solid medicine foundation. You see, medicine is ever changing. As a clinician, you will have to be a lifelong learner. And you have to educate yourself regularly. So don't worry about choosing a specialty. Choose a specialty you love and find an employer that will train you and treat you well. So I know you're gonna ask me this question, what about the PANRE? I know you think that PAs who work in the ER or the urgent care or in primary care will be much more prepared for the PANRE. And that's not true, not true at all. The PANRE is a very nerve-wracking test for any PA, despite your specialty. I worked in primary care for 9 years and I still had to study for that awful test for weeks. So everybody has to study for the PANRE. So don't worry about not passing the PANRE if you choose a specialty. So did you hear what I just said? Choose a specialty and a boss that will nurture your growth. Because that's what you're gonna do your entire career until the day you retire. You're gonna grow into this career. The knowledge and the skills will ebb and flow based on the practice you find yourself in. And this is completely natural. Remember, you are adaptable, you are resilient, and you will be fine. And as always, choose your boss, not your job. Now, if you like this video, go ahead and hit the subscribe button for more content like this and drop a comment with any questions or you just wanna connect with your fellow PA friend here. And I will catch you in the next video, guys. Bye.